Hello, everyone, and welcome to the Empowering People and Community Series, or EPCS. We're glad you're here today for today's conversation. Youth Vaping 101, Back to School, Back to Basics, what parents need to know about youth vaping. I'm Daphne Golden, Senior Manager of Policy and Statewide Coordination with the Louisiana Campaign for Tobacco-Free Living, or TFL, and I'll be your host today. We're excited to have you with us as we launch TFL's Youth Vaping 101 series. As students head back to school, parents, caregivers, educators, and communities may have questions about vaping, what young people are using, what to look for, why young people may vape, and perhaps most importantly, how adults can respond and have those conversations without it turning into a lecture. Before we get started, just a little bit about who we are. The Louisiana Campaign for Tobacco-Free Living, or TFL, is a program of the Louisiana Cancer Research Center and Louisiana Public Health Institute. TFL works across Louisiana to prevent and reduce tobacco use, reduce exposure to secondhand smoke, and address tobacco-related health disparities. Today's webinar is part of TFL's Empowering People and Community series. EPCS is designed to bring practical health education, information, and resources to people and communities across Louisiana, helping participants build knowledge and take informed action on tobacco-related issues. Today, we're going back to school and back to the basics. Our goal is to give you practical information you can take with you, not just the facts about vaping, but information that can help parents, caregivers, and other trusted adults recognize the issue and have a productive conversations with young people. So we'll begin with Chriselle Stipe, Senior Manager of Health Promotions with TFL. Chriselle has more than 25 years of experience in public health program management, tobacco prevention, and tobacco cessation. She is TFL's subject matter expert in tobacco cessation and manages Louisiana's statewide quit line services in partnership with the Louisiana Department of Health and other partners. Today, she'll help us understand the youth vaping landscape, including product influences, nicotine addiction, common misconceptions, and what parents and communities need to know. Later, Chriselle will be joined by Jennifer Hainline for a fireside-style conversation. Jen is a TFL regional manager serving Northeast Louisiana, a licensed clinical social worker, a Monroe City School Board member, and a parent of 2 teenagers. Jennifer has over 30 years of micro, meso, and macro social work experience that includes clinical mental health intervention, national speaking, education about Alzheimer's disease, and crisis intervention. She holds a master's degree in social work from Aurora University, a bachelor's degree in applied psychology from the University of Illinois at Chicago, and has done a fellowship in infant mental health from Tulane University. She brings professional, community, and personal perspectives that will help us take today's information from the presentation into a real-world conversation. So here's what you can expect. We'll spend about 30 minutes with Chriselle's presentation, followed by the 20-minute fireside chat between Jen and Chriselle. We'll have a few minutes for audience questions and your feedback, followed by a quick preview of what's coming in September. You can use the chat or the Q&A throughout the webinar to share your questions or comments. So let's get started. Chriselle, I'll turn it over to you.
Thank you, Daphne. First, before we go into the specifics regarding vaping, we want to start off with the data. So the tobacco or nicotine data, next slide. So there's been a rise in vaping and e-cigarettes across the nation, but also in Louisiana. And so we know that vaping amongst youth in Louisiana is also high, and it's higher than the national average. And according to the 2023 Youth Tobacco Survey that was conducted by the Louisiana Department of Health and also TFL, Tobacco-Free Living, we found that 30% of high school students currently vape. And you can see that breakdown in this visualization here. 30%, you can actually see it highlighted here as far as how many students that would be. Also, in middle school, we found that 18% of middle school students vape, which is still high compared to national averages. Even though numbers look like they're going down across the United States, vaping is still an issue and a problem in Louisiana. Also, according to the Youth Tobacco Survey, this is the information that we found from that survey that most youth try tobacco at the age of 13 or 14 years of age. Over 1 in 3 initiate tobacco by using vaping. So they initiate that tobacco use. It used to be cigarettes years ago, but of course that number's gone down and young people are initiating tobacco use by using e-cigarettes and vape products. Vapes are the most common product used by youth. And following vapes, it's cigars and hookahs. And more than 2 out of 3 youth do not consider vapes to be a tobacco product, which is a barrier and a challenge because of their outlook and their attitudes and thoughts, or their thinking about what vaping is. So next, and this information, of course, we're focusing on parents and caregivers of youth and family members, guardians, who are taking care of youth within a home. We want to focus on educating you all regarding what these products are, how youth are perceiving them. And so next, I'm showing you the different flavors that are out there regarding vape products. And you can see that these flavors, these products and the way that they look are attractive to youth. And so we know that tobacco companies are marketing these products to gain more youth to become addicted. And all of this, of course, makes them more money. So you see these products, they look like candy, they look like everyday products that youth like, including what's actually out there along with vaping is nicotine pouches, which is another product or nicotine product that we're educating youth on. They can become addicted to this product too because it includes nicotine. Next slide. So we'll go over the harm of these vape products. So vaping, a lot of vape products were marketed as only water vapor and that they are safer than combustible cigarettes. We know that that is not true. That marketing caused a lot of young people to use these products, and also their parents to purchase these products for them, thinking that it's safer than cigarettes. Well, we know it's not safer. The e-cigarette aerosol is not water vapor, but you see here the chemicals and metals that are in vape products. Different cancer causing agents, so there's a possibility of a cancer risk. There's different metals within the vape product that you can see here, and some of these chemicals are also in cigarettes. But with the vape pen, you're talking more metals here. Carcinogens, cancer-causing agents, and also with the use of nicotine, the high concentration of nicotine in these products cause withdrawal symptoms. So causing youth and young people to have anxiety, cravings, causing nausea, weight gain, and mood disorders. Um, we have here, basically in this cloud, are the different chemicals that are in vape products. One chemical is a flavoring called diacetyl. And this flavoring is a chemical that, is usually in some foods that we eat. And it's okay to ingest, but it's not okay to inhale. And so inhaling diacetyl can cause something that what we call popcorn lung. So it definitely affects their breathing, and the physical structure of their lungs. And so here, just demonstration, and this is, of course, an X-ray and other tests that have been done on a young person within the hospital that was hospitalized. So you see the comparison of these images. Uh, the more white in the image equals more damage. So if you look at the comparison of the normal lung compared to a vaping lung, you can see that that change is already happening. The damage is already happening within that young person from vaping. And also you can see on the X-ray on the further right, the top is the normal lung and the bottom is the lung after vaping. So again, the more white that you see in this image constitutes more damage to that person's lung. So let's go over the effects of nicotine. Nicotine is the addictive substance in any tobacco products, whether we're talking about vaping, uh, uh, cigarettes, smokeless tobacco. It's the addictive substance. And nicotine actually can cause youth headaches, nausea, just weakness, possibly vomiting, and abdominal cramps. And some effects of nicotine, and thinking about youth here, and of course, these effects happen in adults too, but we're focusing on youth and the vaping epidemic here, and not only vaping, but the ever-changing nicotine products that are being put out by companies to in young adults. So there's an increase in heart and blood pressure. We know that nicotine does that, and it causes the heart to pump harder. There's increased anxiety, trouble focusing, and again, focusing on youth and their brains, their adolescent brains at this time. Trouble focusing, trouble learning, and there's a negative effect on attention, concentration, and memory. Mental health that's related to nicotine. So nicotine is a chemical that actually changes the adolescent brain, uh, the brain cell activity, and parts of the brain that's responsible for that attention span, learning, and memory. So just to show you how nicotine affects the child's brain, it can worsen any type of anxiety. We know that adolescents are at that time in their life where there's a lot of irritability already, mood changes just because of their hormones, anxiety of maybe what they're going through in their lives at that time. But using nicotine can worsen these things. It induces changes within the brain during adolescence that can end up being permanent changes, because the brain is still developing. Nicotine harm can Nicotine's harm can lead to long-term effects on the ability to make decisions, and it can also leave teens with increased risk of addiction to other substances. So nicotine and mental health, and this is information that we've gotten from research and studies is that e-cigarette users report a higher stress than non-users. Think about it, but kids actually use nicotine to try to cope and manage their stress, but they're actually causing more stress to their bodies. Nicotine addiction is also associated with mood disorders, anxiety disorders, and depression is highly associated with the use of vaping and e-products. Also, exposure to nicotine can cause depressive, uh, psychotic disorders. It can also lead to other addictions. From a study that was done, those who reported past 30-day e-cigarette use at age 18, well, at age 19, they more likely reported 30-day cigarette use, alcohol use, marijuana use, non-medical prescription drugs. So that just shows you how vaping is that gateway drug of nicotine use that can lead to other types of abuse. And the use of nicotine cigarettes are associated with a greater likelihood for young adults and adults ages 25 and 54 to vape marijuana. And also, as far as the products and nicotine products, they not only vape nicotine, but you may find out that they are other products are being um, in the used in the vape pen or vape product to also for them to use, such as marijuana, such as other substances. So it's just opening up the door for you to be exposed to not only more nicotine in vaping, but other products as well. So as parents, everyone is here to find out, you know, about vaping. How do you know if your child is vaping? So after knowing all of the information that I provided regarding what vaping is, what it looks like, the damages it may cause to youth, how do I know the signs of vaping? So, there are multiple signs and multiple ways you could recognize if a child is vaping. First, there's physical signs, coughing, dry mouth, shortness of breath, just the reduced stamina when they're doing activities or playing sports, throat irritation. Also, in your home, you may find this faint scent within your house that may, just come out of the blue, and you can't locate what that scent is. It might be in their clothes, it might be on their breath, or within their rooms. So, for example, all of a sudden in your house, you're smelling a burst of strawberry. That might be a sign that there's vaping happening within your home. Um, the youth has an increased level of thirst. So, if they're drinking more all of a sudden, and I'm not talking about one-off situations, but if you find this being constant and there's a pattern, then that might be a clue that something's happening. Um, there's a rise in nosebleeds, so possible nosebleeds with teens, and also your teen, teens these days, they drink coffee and caffeine all the time. So they might have increase in their caffeine consumption because guess what? That nicotine may be replacing that caffeine. So next, as far as the signs of vaping, the behavioral changes that may happen, increased secrecy, maybe guard backpacks or some defensiveness. Again, with youth, those actions may not be common, not be uncommon, I should say. Being defensive, we know that teens go through different emotions. But again, if you see a pattern, be aware. frequent bathroom or outside breaks, especially breaks around the same time each day. Because think about it, when someone actually smokes, they go outside at a specific time, a specific trigger time throughout the day, a morning break, a break after lunch, or afternoon break. So just keep in mind, if you see that pattern, that may be a sign. Mood shifts, anxiety and irritability, more time alone, being withdrawal from friends. And those are just signs of addiction, period, from substances. So it lets you know that nicotine is an addictive substance, just like any other substance. Also, environmental changes, just seeing different unfamiliar devices maybe around the home or that your child has. And also just masking the odors. So if they're lighting candles or a room refresher or scented products all of a sudden, um, it may be just that they like candles, but that's another additional sign, just to cover up that odor of vape products. So, since we have talked about different signs and how, and to be aware of what your child is doing, the next question would be, how do I talk to my child? How do I start this conversation? So here are some steps, and we're going to provide you, even after this webinar, with these resources once we finish. But here are some steps how to talk to your youth. Before you talk, know the facts. We have resources available. There are resources for parents and caregivers and family members to familiarize themselves with what vaping is. Consider your child's viewpoint, um, how you were at that age. So before you talk to them, consider how they're maybe thinking about this. Take an open and calm approach with try not to be too intimidating or too harsh because you want them to be open for a conversation and find the right place and the right time. Maybe an opportunity could be when they're watching something on TV and they're showing a person vaping. That might be an opportunity to maybe have a talk with them. So while you're talking, acknowledge their independence. Let them know that, they are adolescent and you know that they're at that age where they're trying to make their own decisions. So acknowledge their independence. Ask for their perspective. How do you feel about vaping? Be ready to hear that your child has tried vaping. I know that's difficult. And a lot of parents may think, not my child, but you just never know. So be ready to hear something that's unexpected. Awareness, giving them awareness about the tobacco companies and their focus as far as trying to get youth hooked. So blaming big tobacco and not your child. Avoid scare tactics. Sometimes that may work with some youth, but for the most part, scare tactics may not work. Thinking about how adolescents are, and they try to, a lot of them may go against what, they think they know better than what the adults do. So scare tactics and just provide them with the information. Connect with what they care about, playing sports, working out, just overall health and well-being. Um, if focusing on, if they continue to vape, what could it possibly lead to as far as their health and wellness? So after you talk with the child, help them manage their stress in a healthy way. A lot of times they might say that they're using it to cope and deal with life is so stressed, but providing them with healthy ways of managing their stress and helping them through that and being an ear for them if there's any particular reason why they're vaping. Sometimes there's an underlying reason. And so the answer is to handle what that underlying reason is. Um, Manage their peer pressure, help them to do that, to handle when other youth are pressuring them to use the product, and then follow up with them. It's not a one-time conversation. Stay up to date on just the ever evolving issue of nicotine products that are targeting youth. So we know we're talking about vaping and e-cigarette type products. We've mentioned the nicotine pouches that youth are using increasingly. We are finding that that's happening also. And we just never know what other products will be coming out there. So keep that conversation going and stay up to date with the information that's coming out about nicotine products. As far as giving them tips on how to handle, peer pressure, um, having them giving them ideas on how to make decisions. So have them weigh the pros and cons, listing reasons people vape and comparing that to the reasons they do not vape. And so we have some just simple reasons here, but this would be a good way to engage this information into conversation. Reasons people vape, they usually use it to deal with stress and anxiety. They don't think that it's bad compared to smoking. It tastes good, it feels good, they do it to fit in. And some reasons not to vape, focusing on all of those reasons why they should not vape. That addiction, of course, the health effects of vaping, and how lung disease and brain damage can happen at that young age. A lot of times youth may think that, oh, this stuff might happen when I get older, but we're seeing some things happening with youth now while they're vaping, just immediately health effects. So just in summary, focus on the root cause as to why, they're vaping. Um, Educate, do not discipline or punish, but continually educate them. Watch your language, for the person first. Instead of smoker, use the phrase person who smokes, or like for example, instead of saying mentally ill, you would say a person who experiences anxiety. Identify what your goal is with your kid. Provide them with resources. If you feel like after your conversation with them, they need to see something more like a video, you can provide them with those resources to look at. And then offer help. Offer help to them if they need help quitting, if they need help dealing with peer pressure. And so this is in summary what we're recommending parents to do as far as trying to address the vape issue within their home. And now I'm going to turn things over to Daphne.
Hey, Kershaw, thank you so much for that, for laying that foundation, really giving us a lot to think about what vaping is, what it looks like, what damages it causes, and how to start those conversations, which we know can be really difficult. I saw a question. Yes, we'll be able to provide the slides and additional resources that public health professionals or anyone really can share with parents, caregivers, and other trusted adults. But now we want to move from the information that Chriselle provided to the conversation. So joining us for the fireside chat is Jen Hainline. Again, Jen is a TFL regional manager for Region 8. That's up in Northeast Louisiana. And as we mentioned earlier, Jen brings a unique perspective as a parent, professional, community leader. She'll help us explore what vaping can look like in real life, from recognizing the signs to having those sometimes difficult conversations with young people. Chriselle will lead us through that conversation. Chriselle is a parent as well. And Haley and I will be monitoring the chat and the Q&A. So please use the chat and Q&A throughout the webinar to share your questions or comments or concerns. Chriselle, Jen, I'll turn it over to you guys. Thank you.
Thank you. Thank you, Daphne. Welcome, Jen Hainline. And Jen, so you're a parent of two teenagers.
Mhm.
Why is talking with teens about vaping sometimes so hard? What do parents tend to get wrong?
Ooh, that's a tough question. Well, I mean, I think I'm going to start with the second question first. I think what parents tend to get wrong is talking about things after they've happened. We have this idea that when we talk about negative things with kids, it's going to make them happen. So we kind of wait to have those conversations. But the problem is, and the stats show, most of these kids are starting by age 12 or 13. And a lot of parents are waiting until high school to talk about that. And then the addiction's really already kind of taken hold on of these kids. And so I think having conversations early and often throughout developmental phases, but it has to be appropriate. It can't be talking to a 5-year-old the same way that I'd talk to my 15-year-old. This is a very different conversation about that. And I think that, and as a parent, we want to protect our kids so much. And a lot of us grew up with that mentality or that message of control and not education, right? So they're just going to tell us what to do and how to do it, and that we have to comply. And this is a very different generation of kids because they have so much more access to information, those kinds of things. So starting young and really breeding that critical eye of our kids to think about what they're doing and why they're doing it. And those kinds of things are really important. And to have a relationship of communication with your child is so crucial because when you get to those teenage years, man, there's so much going on with those kids between hormones and development and the social stuff, all of that. The communication gets really complicated if you haven't laid the groundwork first. So I think that that's something that we need to keep in mind. But all is not lost. If the groundwork wasn't laid, it doesn't mean that we can't take some steps back and go, you know what? Hey, I want to have a conversation with you, and not because I'm here to tell you what to do, because I love you and care about you. And I'm your tour guide. I already went the path. I learned the mistakes, and I'm here to share them with you so you don't fall into the quicksand. It's that kind of conversation. And remembering that we're kind of partners to help them maybe do better than we did.
Exactly, exactly. And a lot of it is just explaining to them, hey, we were where you are now.
Mhm.
So sharing that wisdom. What do you think that teens wish adults understood?
Oh gosh. I think my teens wish that I understood that I'm maybe slower than they are in some ways. Which is funny because I think I pride myself on getting things done in a very rapid pace and all that. But also that there's a lot that we don't know about their culture. And there really is. My daughter was talking about some cartoon genre oh gosh, and now I can't even remember the term for it, but I'd never heard of it. She's like, "Oh yeah, this is a common conversation about why nobody liked this particular movie put out by Disney." And I was like, "Oh, I didn't even know that." But it's the common nomenclature, but I don't know. I mean, it's not come up before. Why would I know? But I
Right.
think that they think that we just don't understand I mean, we were the same way. Our parents didn't understand what it was like for us in high school, right? And so, I mean, kids these days they're no different. And to a certain
Right.
extent, we don't. I mean, because the things that are going on in those halls, some of the stuff I hear about, whoo, it's rough. It's rough out there.
Yeah. Yeah. Yeah, I agree. It takes a lot of learning from our part too, as
Yeah.
parents, learning what they're teen culture is right now,
Mm.
along with the education and conversation we're providing. So you also work directly with young people and families through TFL. What are some things that you're hearing from teens about vaping and that parents may not realize?
Well, I mean, I think the most common thing that I hear is the amount of stress and strain that the youth are experiencing. You know, kids today are inundated with so much more information than we ever were. Whether, it's stuff going on in the world, in the country, even in their own neighborhoods. I mean, sometimes I come across things that I know weren't supposed to come to me. And I see like fights and I see these things going on daily in the community. And so, they're really experiencing so much more, and that anxiety and stress is at an all-time high. And so I think that that's part of goes back to what I think kids feel like a lot of their parents don't understand, just what the gravity of what they're experiencing. And then the outlook for life. You can't, I'm constantly hearing the messages of unaffordability and, these degrees are so expensive nowadays. So if they want to go to college, like how are they going to afford it? And then, what's going to happen after that? Are there going to be jobs? And so there's those things. And so you kind of want to shut out thinking about that. So they're really just live and in the moment right now, which is also part of development too. I mean, there's just not a lot of future thinking and worrying about what's going to happen or what are consequences of our behavior. Normal brain development, we just don't think about that at that age. Um, so I mean, there's just so many different things that are happening with them. But yeah, between the stress, the peer pressure, the misinformation about what vaping is, was, or what's in it, those kinds of things are all part of what I'm
Mhm.
seeing. And then parents just kind of being out of touch or being too busy or being too disconnected from their kid, that there's that big chasm between the child and the parent where that communication's not happening and big breakdowns happen. So I think those are the big pieces that we need to look out for.
Right. You're exactly right. Have you heard anything from young people that surprised you about vaping?
Um, This isn't something I've heard, but we even in my kids' high school this year, they decided to go clear backpacks, and the reason was because of vaping. And one of the other schools that I went and spoke to last year said that she's like, the principal pulled me aside. She goes, "Can you please talk to these kids about stop putting their vapes in their underwear because then they're sharing their vapes with other kids and that bacteria is in the vape and it just I had this visceral reaction. That was one that like
Yeah,
I hadn't connected the dots like why that is so gross.
right,
But and so I'm kind of mad about the clear backpacks because I'm like, don't make them hide it in their underwear. For God's sake, it's gonna, but I mean, that was one thing that I think that I'm really surprised about. I'm also constantly. So I've been doing this for over a decade, and the knowledge that these students have. So I'll give an example. Farmerville, Louisiana, Union Parish, very rural. I'm doing a talk recently, and I do like kind of throw a question out and see what they know. And these kids know now, like they didn't 10 years ago. You raise your hand
right,
if you think vapes are safe. They'd all raise their hands, whatever. Now, no, I mean, these kids, they catch up, they catch on quicker, I think, than we did. I mean, it took us like 50 years to realize cigarettes are bad. These kids are
right.
catching up quicker. So that's also really impressed me. And how these, I mean, kids really just respect being, leveled with and being treated like the intelligent kids that they are, and give
Mhm.
them the facts and let them decide. I mean, it's still up to them to decide, but at least they know
Right,
the facts. I think that
exactly.
that's, always been surprising. And, with my kids, one of my ways of communicating with my kids was I'm not going to go on to the, all drugs are bad, just that conversation, so don't touch them. we're going to talk about why they're bad. They feel good at first. Nicotine feels good at first. Of course it does. Why you wouldn't do it again if it felt terrible at first.
Mhm.
And so you have to help kids understand like what the process is, not just it's bad, don't do it, but like communicate what's bad about it and why it's bad and how it will catch up with them. And some will still choose to, do things that are going to harm themselves, but that's usually because they're, trying to address something else going on.
Exactly, I agree. If you tell a youth or a teen, just don't do it because I say so, that's not going to fly. We
Yeah.
know that just from, when we were that age.
Hmm.
And it's the telling them why, the reasons. And this was actually told to us by one of our youth in our youth advisory board. We have youth advisors represented across the state, and they come together, and that's one of the things that they said was that don't just tell me not to do something. Tell me why. Why? Explain to me
Hmm.
why. So definitely thanks for that insight, Jennifer. Um, my next question is let's see. So teens can have some pretty quick responses. What if your child says everybody does it or it's just flavoring? How can parents respond without turning it into an argument?
Yeah, I mean, I think that it's about, the conversation of really, well, let's try to figure out if that's true, and don't pretend you're the expert. I mean, even though, I tend to be more of an expert with this particular topic with my own kids, when we're having a conversation, nobody likes a know-it-all. And so we want to, make it more of a conversation. If you were telling, a 5-year-old, would you be explaining to them, hey, this is totally safe, go ahead and use it? And I think if you can put it in the role of them teaching younger kids, that might help for them to put it in a perspective as well. And again, it goes back to let's not chastise, let's not, be the control freak. Let's be the one who promotes the conversation and the critical thinking, because that's really what it is. I mean, we're talking about vaping, but these kinds of skills apply to so many things that we really want to equip our children, our teenagers with the skills necessary to be successful. And part of that is saying, okay, well, let's look at what are the facts and where are you getting your information? Because the other thing I tell these kids when I go do talks at schools is, look, if I go do a search on vaping, my algorithm knows what I do for a living. So I'm not going to get like, vaping's great, come buy them here. I don't get that. But
Mhm.
what they might get might be some of that misinformation. And so they also have to be critical about them and their algorithms and what they're searching and what they're getting back and what are the sources, because that's really crucial to understanding, what's going on. I mean, I think even as adults, we have many topics that come up, particularly lately, that we have to put on our critical thinking hats and say, is that accurate? Is that the information? Is that what the research is telling me about this, that, or the other thing? So we just want to,
Mhm.
ask the same for our kids.
Right, right. Thank you for that. What about a parent who discovers that their teen is already vaping? Is it too late to help? What could they do to be supportive?
Yeah, well, I mean, obviously it's never too late to help. And I had a situation where one of my daughter's friends was vaping, and it's when I spoke to them, I said, um, just tell me what's going on in your life. What are you experiencing that vaping is helping with? What is this doing for you? And it's really about having, I mean, I keep saying this, but having that conversation, and respecting what they have to say, not discounting it or saying that's ridiculous or that's dumb. And I mean, not encouraging it either, but validating their experience and why they're self-medicating, because that's really what it comes to, whether it's nicotine or another drug. This is a path of self-medication to try to deal with something that's going on internally. And our society for decades upon decades has really had a conflict with openly accepting that mental health is physical health. And so it's really hard for folks to talk about and also just to articulate like what is wrong or how they're feeling or why they're feeling it. Just even not even why, but just like the what. What are they feeling? That's so difficult. And a lot of us don't have the language for that. So, and it's also understanding our own limitations. If I'm experiencing something where I can't have a supportive, open, validating conversation with my child, then I've got to find someone who can help us do that. But it involves a lot of listening. You got to listen a lot.
Yes, yes. And thank you for incorporating that behavioral health slash mental health part of all of this. Um, um, you may have teens that are dealing with something like depression, generalized anxiety, and then you got teens that are just stressed and worried. That's behavioral health
Hmm.
too. So just a parent, a guardian, understanding that part of it, nervousness, worrying, and just anxiety and stress. That is a part of behavioral health. It may not be like a diagnosis. It may not be bipolar or, some other disorder, but that
Hmm.
is that mind wellness, that may be affected with everything that's happening, and maybe, using that product to cope with it. Like, other people use other substances to cope with it. So
Hmm.
thank you so much for bringing that to that part of the conversation to the forefront, because talking about underlying reasons as to why youth are vaping, it may be for a parent or guardian to actually help them address that underlying reason. So I think we're almost at time. So I will turn things back over to Daphne.
Well, Chriselle, I hate to interrupt. This has been a master class in listening to you because this is the work that you do every day and that you also live. So, Jen, thank you for being so open and honest, sharing your perspective, your personal experiences with your kids, what you're seeing there. I just remember that one story you said you were presenting one time and the kid was like, "You don't know anything," but clearly that's not true. So you probably hear it all. You've given us a lot to think about. Parents, caregivers, and the trusted adults. You've given them some tools and strategies, and that it's okay for parents not that they're not alone, and it's okay to ask questions or have questions about how to talk to their kids. Um, so I think we've had a question in the chat. So thank you for that. Someone asked, I am a nicotine replacement provider and wondering how therapy is applied to youth and preteens. Erica, thank you for that question.
Yeah, Erica, thank you. So with youth and preteens, we actually have a Live Vape Free program that's available for youth. It's completely a text-based program because we know that youth are researching and they gain their knowledge from using technology. So we have a Live Vape Free program that's providing them with the tips and strategies, so that coaching and counseling that comes along with trying to quit. Um, we have certified coaches who are able to provide that with them, tips and strategies, identifying what's their trigger as far as what's causing them to vape. So helping them go through that process. As far as nicotine replacement therapy, we actually refer them to their provider, because at that, well, especially if they're under the age of 18. So that age between 13 and 17, if they go through our services, we're recommending that they contact their provider, because that person, best knows, their mental and physical condition, and they're under the age. And so that's our best recommendation.
Okay, thank you. For those of you joining us live, we'd love to hear from you. So if you've got chats or questions or comments, please put them in the chat. And Chriselle, just thinking about, and Jen as well too, thinking about the work that you do. Can you tell us a little bit more, like Jen, what are you doing in the schools, from the TFL perspective as a regional rep, about the presentations that you're giving or the conversations that you're having?
I think, well, we start with the administration. We also talk about what are their policies when they do catch somebody vaping. What are they
Mhm.
doing? Because there's a lot of really punitive policies, and that, it's just not restorative. It doesn't help that youth deal with the stress because if they're disciplining the student for using vapes and taking them out of the classroom, that's creating more stress and strain in their lives. So it's kind of creating this vicious cycle. And so we really want them to consider what kind of resources they can plug that student into. And then with the students, I forgot about that comment with the student who said, "You don't know anything." Because what he was saying was, because I was giving the kids too much credit, he felt like, because I kept saying, "You guys are so smart. You're one of the smartest generations. You have so much information. You know more things than we ever knew." And that's where he was like, "You don't know anything about this generation," which I would rather be at fault for giving him too much credit than not enough. But I mean, for me, it's really been about, and I even see, in some of our slides, we've done the presentation for youth, and then we listen to them. We get the feedback like, did this reach you? What did we miss? What did we get right? What did we get wrong? And they wanted to see more real life. They didn't want to just hear the rhetoric that it's harmful. They wanted to see that lung visualization. They wanted proof that this is harmful, not just an old lady telling them it's bad for you. They wanted to see for themselves. They want the proof. So that's and it makes sense. I mean, I don't know. I'm a critical thinker too. I like to know. I don't like to just believe everybody and what they're telling me. So I like to be able to follow up and look up things myself. So, I mean, that's really, and when it comes down to when you share that information, they say that it makes an impact.
Great. Thank you. Do you get a chance to talk to parents at all, like at, the PTOs or parent teacher association groups? Is that an
Some I
opportunity?
do, yeah. It's not as often because it's hard to get them all in one place at one time. But yes, when I
Mm-hmm.
do get a conversation to talk about it, it's similar to the question that was asked in the chat. Like, okay, so my kid is using this. What can we do? I got invited by the juvenile court system as well, and parents were required to come with them for that. And so being able to talk to them about again how to have that relationship with your child, how to talk to them, how to really listen and hear what they're going through as well. Those are the pieces that are really important. A lot of it's just about that relationship. It's so key.
Mm-hmm. Mm-hmm. Are there questions in the chat I may not be seeing at this time?
I
So,
think we're
Chriselle,
going
let's.
to roll into the poll.
Okay, all right. We'll transition to the poll. I was just gonna just kind of wrap it up there and say, Chriselle, let's bring it on home. If every parent watching today, whether live or watching the recording later on, did just one thing differently after this conversation, after watching this webinar, what would you want that one thing to be?
I'm sorry, I didn't hear you. Say it again.
I'm sorry, did I? Okay. Just kind of like, what's the big takeaway? After a parent listening here live, or watching the recording later, what's the big, takeaway? What's the one thing you would want them to
I,
to
I
know
would
or
say
do?
the big takeaway would be listen to your kids, be open to conversation. And I think everything that we talked about today circles that. Just being open and not trying to punish them for everything, but just trying to get an understanding because you're letting them know that you want to understand. what they're going through. So I think the biggest takeaway would be have a conversation with the kids, your youth. We're providing you with resources to help you do that. Some of the tips that are in the PowerPoint today, which we'll be sending out to you all afterwards, along with some other resources, can help guide you into, making a direct conversation with your kids. And just to continue that conversation, don't let it be one conversation and it ends.
Thank you for that. So before we wrap up, we really appreciate your feedback, those of you joining us live. You'll see a short questionnaire pop up about now, and it just takes a couple of minutes. And if you could give us your input, it really helps us make future EPCS sessions more useful and relevant.
And Daphne, I wanted to throw out there too
Sure,
for
sure.
anybody who's on the webinar and needs someone to come out and talk to. Maybe there's some school counselors on there, people who work in the community. Um, our organization, we have regional managers all over the state who are more than happy to come out, provide information. We can provide talks, and it's of no cost. But it's definitely, we're here for resource. So feel free to reach out and contact us. The website's up on your screen right now, tobaccofreeliving.org.
Yes,
Yeah, so
thank you.
while everyone is completing the short questionnaire, just wanted to kind of go through the resources here. So, any information that you want to know about tobacco-free living and our programming, we have our website here. Also, the work that we do in partnership with the health department is here. Unfiltered Facts is also a website that's good for parents and you to get just facts and information regarding nicotine and vaping. We have the 1-800-QUIT NOW number. That's for, adults and youth who are trying to quit nicotine and tobacco and live vape free, particularly for teens, young adults. We have that completely text-based program, digital program. Along with teens, those teens grow up to be young adults that age 18 through 25 who kind of get lost in the gap. They're not teens anymore and they're adults, but they're also young adults. So that brain development is still happening at that time. And so we have the service specifically for those different age groups. And then also PAVE, which is a really good resource for parents, parents against vaping e-cigs. And so the resource is there for that. So we're providing you with a lot of resources just to give you some information and where they can go for tips and help to quit vaping, but just nicotine products because we don't want to exclude those nicotine pouches that are out there too that youth are utilizing.
Thank you for going through those resources. And Chriselle, you'll be back next month. Before we go, just here's a quick preview of what's coming next month. Coming in September, from quitline to lung cancer screening, closing the gap. What if helping someone quit tobacco could also help save their life? Well, we'll look at an exciting Louisiana effort connecting people who use the Louisiana Quit Line with lung cancer screening and nurse navigation services. It's about making the connection easier, from quit to screen to early detection. We hope you'll join us for that conversation. Stay tuned for more details. Again, thank you, Chriselle and Jen. This was our launch of our Youth Vaping 101 series. Thank you for everyone who joined. We will be sharing the recording and resources following the webinar. Thank you, a big thank you to our social media content coordinator, Haley Osiagu, for helping us with today's technology and webinar logistics. Thank you, Haley. And thank you all for being part of the Empowering People and Community series. We hope you leave with a better understanding of youth and vaping and practical information you can take back to your families, schools, workplaces, and communities. Have a great afternoon, everyone.
Bye, everyone.
Bye. Thank you.